My dear friends, in this video I'll show you how you can gain mastery over the use of the second instrument in order to make it work for you during the process of phacoemulsification. Remember, the second instrument should not play a second fiddle to the phaco procedure. In fact, it cannot remain a silent spectator, but rather it should be an active participant in the process of the direct phaco chop. The phaco surgeon therefore needs to work on his level of ambidexterity to a certain extent in order to maximize the participation of the second instrument during the direct phaco chop. Let me show you how you can unleash the full capabilities of the second instrument so that you can train your non-dominant hand to achieve the best possible results while you perform your direct phaco chop. In this video, you can see that the second instrument that I am using is a 1.25 millimeter sharp tip chopper. After impaling the nucleus with the phaco probe, the sharp tip chopper will initiate the crack. It is the phaco probe is then driven into the face of the split nucleus. And while the phaco probe buries into the face of the split nucleus, as you can see, this part of the procedure, the dominant hand is stationary, does not move at all. So what deepens the crack and creates the separation is by judicious use of the second instrument. The second instrument, namely the chopper, is taken deep into the crack, it is flexed, and with a gentle movement, lateral separation is achieved. So you can see that the most dominant role in direct phaco chop is actually happening in the second or the non-dominant hand with the help of the sharp tip chopper. While the sharp tip chopper is facing downwards, it's very important that you do not allow it to stray to the periphery, as it may cause damage to the edge of the rhexis. So once the nucleus piece has been mobilized, the sharp tip chopper is brought more anteriorly and it is made to lie flat above the surface of the iris. Now, this will minimize damage to the capsular rhexis. Also, you can see that the orientation of the chopper is flat, that is, the sharp tip is turned inwards and is made to lie flat. The sharp tip chopper actively participates in phacoemulsification by repositioning and feeding the pieces to the phaco tip. I also use the sharp tip chopper to pulverize the nucleus mechanically in order to minimize the phaco energy. But while performing this maneuver, you have to be very careful that you do not contact the phaco tip with the sharp chopper, as this can cause damage to both the tip as well as the chopper. So maybe it is not a good idea to do this. You just use the sharp chopper to manually position the pieces optimally so that occlusion can occur fast and the phacoemulsification can take place with minimal amount of phaco energy. It's very important to note that you need to orient the sharp chopper horizontally while you mobilize the nucleus pieces and while we are doing fragment removal. This is because if there is a sudden surge and the PC rises up, it will not contact the sharp tip of the chopper. The sharp tip of the chopper or the second instrument is constantly working to position the pieces against the phaco tip, to pulverize the pieces against the phaco tip, and therefore plays a pivotal role in successfully completing the phacoemulsification procedure. Let's take a look once again at the role which the second instrument plays during a direct phaco chop. So after burying the phaco tip, I'm initiating the crack with the second instrument. So the phaco probe now buries into the split portion of the nucleus, and its primary role is to hold on to this piece and remain stationary. The deep crack and the separation is effected solely with the help of the second instrument, and that's why you need to develop your ambidexterity levels to a great extent. The rotation of the pieces is also done with the second instrument, and while rotating the pieces, the sharp tip of the chopper faces posteriorly, but the minute the chop is completed, the sharp tip is automatically turned horizontally so that it becomes safe to use. Once The fragments have been mobilized and fragment removal is in progress. The sharp tip chopper or the second instrument is now used to feed the pieces, to reposition the pieces, to achieve optimal occlusion of the phaco tip, and therefore enable you to quickly and safely apply the phaco energy into the pieces for safe and effective removal of the pieces. Now this medley of events should be mastered by you in a very slow and controlled manner. You should know that while creating the chop, you should make the sharp tip of the chopper face posteriorly, and during mobilization, you should make the chopper lie flat so that it does not damage the surrounding structures. You should use the second instrument judiciously to feed and reposition the pieces of the phaco tip to enable quick occlusion and effective phacoemulsification. Thank you for your kind attention.